The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Hi, everybody, and welcome to another edition of Humanity First. My name is Peter Evers. I'm the CEO of BAMSI. And this week, we're going to be talking about infectious diseases, and we're going to talk about vaccine hesitancy. And we have a wonderful guest who is from Southcoast Health. He is one of the infectious diseases doctors that works down there. His name is Dr. Q. And we're going to talk about this issue of why we're seeing an uptick in measles, something that actually the CDC noted in 2019 had been eradicated in this country. And is this a public policy issue? I think it is. I think we are not messaging well enough in terms of public health and population health that vaccines save lives and vaccines are important as we encounter some of these diseases and some of these infections that we have thought have been eradicated for many years. So let's talk about that because there's a lot of ground to cover. So we'll be right back.
Hi, I'm Jamie. I'm an essential worker here at BAMSI, and I'm a nurse. Nurses are essential here at BAMSI because as nurses, we really have the opportunity to make an impact. We have very small ratios, so we have the opportunity to really learn everything about the person served and be able to give the best care. It really serves such a great purpose for me as being a nurse and really why I came into nursing. Learn more about nursing opportunities at bamsijobs.org.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
And welcome back, everybody, to Humanity First. My name is Peter Evers, and I have the privilege of being the CEO of BAMSI. And as we talked about in the first section today, we have Dr. Ming Da Qu with us, who is an infectious disease specialist physician out of the South Shore Health Group. Dr. Q, thank you so much for joining us today.
Hey, and thank you very much for having me on. One small correction is, this is, South Shore is a health entity in Massachusetts, but I'm with South Coast.
Oh,
It's not a big deal, but I did
uh,
want to at least so there's no confusion there. And before we proceed, I'll also say that anything I'm saying from my end is, this is not representative of my employer, just my own opinions and yeah, my own medical views. So sure, absolutely.
Thank you. And I absolutely apologize for that because we talked
It's okay.
about South Coast before. So thank you.
Don't worry.
Thank you for that correction. So yeah, I mean, I'd love to have a conversation today around the state of the nation in terms of infectious diseases. We have survived, I'd say, many people didn't survive, come through a pandemic that has really threatened the way we look at public health, I would say, in this country. Many people would say that this sort of a pandemic that we've had has been coming for a few years, and maybe there's been some indicators of that. But now I think we've sort of gone through COVID, and I noticed the other day that there was an uptick in this country. I don't think it's even regional in this country about measles, which is really interesting to me because when I was a kid, which was of course an awful long time ago, I remember my mother, who was a nurse, by the way, taking me to what she called measles and mumps parties, and we would go and play with other kids who had measles at a certain age. Of course, we've come a long way in thinking from then, and we've talked about vaccines. And first of all, can you shed a little light on what is going on with infectious diseases like measles now? And why are we seeing an uptick at the moment?
Right, right. So yeah, let's talk about measles. I want to at least talk about measles from the perspective of the United States first, and then kind of catch us up to speed about what's going on more recently. So the big milestone is that as of the year 2000, it was declared that measles as an endemic disease to the United States has been eliminated, and that was largely due to vaccination efforts and vaccination coverage. In fact, the CDC's the recommendation is in the United States is that kindergartners, so because it is a vaccine that's available starting at 6 months of age, and it is typically a two-dose series to finish out the series. And it started usually in childhood, it's kind of like the standard time to start it, is that they look at kindergartners and they suggest that the vaccination coverage should be 95% at least among kindergartners in the United States, period. That's kind of like the bar that's been set there to kind of keep things the way that have been since essentially eradication. And basically, as it were, I'm actually in front of a computer right now looking at the CDC because CDC has a great updated webpage that lists statistics of what's going on with measles in the United States and also abroad, but definitely a lot of details in the United States right now. So this includes tracking the weekly measles documented cases uh, throughout this last year or so. And what I'm noticing looking at this graph right now is that the y-axis right now on this graph, by the way, is number of cases per week. And thankfully, it only goes up as high as 40 is the upper limit of the y-axis, so cases per week. And then the x-axis is going to be basically the noted week, and they have denominations per week there. So I'm looking at this chart right now, and actually, as of even like there's a big probably the apex I'm seeing just by week basis in the last couple months would be in around like March 17th. It looks like there was a documentation of about uh, the cases eight. It's pretty much looking like about the 35 between 35 and 40 range at that point. And then what more kind of like longitudinally, so far in 2022, and so far this year, 2024, there have been 131 documented cases of measles in the United States. Of those people who were found to have measles, 81% were found to have, regards to their vaccination status, unvaccinated status, or unknown, actually. And 14% had one dose of the measles vaccine, and 5% of those cases, there were two doses of the measles vaccination. And to give you right a sense of it's not necessarily, and I'll get into a little bit about why there are a lot of reasons why it's important to try to prevent measles before it spreads and becomes an issue in terms of namely outbreaks. But just looking at just another statistical kind of sobering statistic here is that of those 131 documented measles infections, 53% of those people are hospitalized. And, it's
Wow.
not necessarily right. And there are a number of reasons why that can be the case. And there's quite a bit of a spread in ages too. Like of those 50%, 53% are hospitalized, half of those are greater than 20 years old. And the rest are, by implication under that age. So it does affect a wide range of people. It can have consequences leading up to hospitalization. I'll get into a lot more details right now, but that's kind of the current trends as is in the United States. Again, for perspective, when you look at that same graph, say like in January 2023, there was only like one case per week or so. And then what I'm noticing on this graph, at least from the span of 2023 till 2024, is that somewhere in the span of, I would say, September-ish to December-ish, it's really been kind of steadily upticking in terms of like the week by week case frequency. And yeah.
So what's the origin of that? So we're cruising along and this really isn't an issue, and you get this odd case speckled around,
Mm,
and then you begin to see this gradual climb. Now we have a backdrop which is kind of different maybe than it was 10 years ago relative to public health, relative to public population health. We've had in some ways we've had this sort of change in health philosophy, haven't we? Which I'm fascinated in, this idea that the medical profession can't be trusted. And this, of course, was incredibly evident in a small number of people who spread a lot of misinformation around what can happen if you get the COVID virus, for instance, from things like, and I'll say I was working up in New Hampshire for a while, and one of the reps in the House was actually passing out information to other people, other legislators about chips being in the vaccine that
Sure, yeah.
would follow people. So is that having an effect? Is that kind of misinformation having an effect on the confidence of our population in infectious disease control?
So, so before I get answer that, I did want to also back up, and on that same CDC site, they do list also the yearly number of cases in the United States, spanning, it looks like in this range from 2000 to 2024. 2000 was once again the kind of year that was declared eliminated in the United States as an endemic disease, at least. And to be very clear, right now, thankfully, measles is not reverted to being saying it's an endemic disease in the United States anymore. Still consider eliminated, but I'll get into kind of factors leading to the increase and answer your question too, is that looking even before the last couple of years, you can see by reading the graph is that somewhere between like 2015, 2018, there was quite a large increase overall too. And we're not, thankfully, for perspective, so far in 2023, 2024, we're not anywhere near those heights of yearly cases.
Right.
So there is some silver lining there. But to get to your point, I think I'll put it this way. One thing I think, from what I've heard, and definitely you were mentioned about the microchip concerns in the COVID vaccine, and there have been concerns about just, and this is more based on what I'm seeing. Not, I have to admit, I haven't looked at like really rigorous research studies examining like people surveyed attitudes about vaccination in general, but I can certainly go from some clinical experience about some degree and aspects of vaccine hesitancy for a number of reasons, especially in the last few years with COVID vaccinations coming out and the boosters and whatnot. Is that basically what you're saying is it is something where anecdotally there are people who, for a number of reasons, do not necessarily want vaccinations or they want their children to have vaccinations. And I think it spans a number of reasons. Like from my own personal clinical experience, there are some people who, for instance, and this is more focused on COVID, did have the COVID vaccination of some variety, and they had some either an established like an allergic reaction, or they had some type of medical phenomenon that happened in the wake of it that may have been related to the COVID vaccine. And, understandably, I think those are definitely from personal experience situations in which I totally understand why they are hesitant about further vaccination.
Right.
I think some people too, when the case comes to COVID, when the vaccine was still rolling out, it was a situation where there were concerns about people about perhaps like the what we say the emergency essentially approval of it. It was a kind of a fast tracking of some sorts. It doesn't mean that it wasn't rigorously scientifically approved, but it was something where in past vaccinations, there's more time to kind of go over and kind of like survey and basically go through a lot of the different steps that it was a different time frame basically. Once again, I want to stress that it was not like rushed out the door necessarily, but there's a different kind of aspect in terms of like how much time was allocated to the kind of pre-approval period, so to speak, for the vaccinations. When it comes to measles vaccinations, this is a little bit tricky because, for full disclosure, I'm not a pediatric practitioner, and probably I would say the lion's share of measles vaccinations has to do with go through the offices of primary care providers, pediatric providers. I am not someone who's routinely prescribing the measles, mumps, and rubella vaccine just by the sheer nature of the population I'm seeing clinically. So, in terms of like direct clinical experience, in terms of vaccine hesitancy regarding measles vaccination, it's hard. I can't really comment. There is, I think, really historically, a lot of the hesitancy had to do with autism concerns and has to do with a components of the vaccines that this goes back, and this has been thoroughly debunked. It's not a link to autism. There's no established link to autism and the measles, mumps, and rubella vaccination. And I think for a while, that from what I heard, is that was a big aspect of the hesitancy of it. And to your point too about changing views about trust in healthcare providers, I think I have personally seen is that, generally speaking, when it comes to issues of infectious disease, I have talked to people who they will disagree or they'll have different opinions based on either experiences with other providers or their own reading of different types of sources or talking to other people. in their life, and certainly people are allowed to build their own opinions. I mean, I think my role is, I think of myself as an advisor. I'm giving a medical opinion. Part of principle of medical healthcare in the United States is to respect the person's autonomy.
Yep.
So ultimately, I can just give through my expertise and my learning and my own experiences, I can say, look, this is what I would recommend because of X, Y, or Z. Here are some alternatives if you don't want to do that. And I can kind of give like a strength of recommendation. Either, I heavily recommend you do this versus, this is something that may benefit you. So generally, my clinical approach, when it comes to my own patient care and interactions. So I want to kind of pivot back a little bit because now this is kind of being a long answer, but when it comes to measles, so specifically when measles, I mentioned is not endemic in the United States. Right now, the current stance and thinking is that the case of measles are being identified in the United States are due to, generally speaking, people who most of it's due to people who travel abroad to areas where there is higher circulation of measles, and those travelers from the United States, unfortunately, may be unvaccinated or under-vaccinated. And there is still some minority people who are fully vaccinated, who, for a number of reasons, if you go to an area with circulating measles outbreaks, they can still be unfortunate. It's so contagious they can still unfortunately still bring it back.
Yeah.
Those are kind of scenarios that we're looking at. And the reason I want to stress that is that from what the CDC's opinion about what's going on globally is that it's, unfortunately, especially in the last couple of years, when COVID was really raging, there was a plummeting of vaccination for MMR internationally. So that could certainly lead to a large percentage of what we're seeing. Although, albeit that wouldn't really explain, as I mentioned, looking at the yearly trends, what's happened between 2012 and 2018, of
Right.
course.
Right.
So I think that's only part of the picture, right?
Yeah, it's fascinating though, isn't it? Because I think as we look at this, we have this confluence of events that are happening. One is the globalization of the planet, right? That
Yep.
really, I mean, I can probably be in Europe within less than 24 hours if I really needed an air ticket right now. I could get back, and I could get back in the same amount of time. At the same time, there's the internet where information abounds, right? And and there really isn't any control over what that or information is put out. And then you get people like Andrew Wakefield, who basically made his name on, publishing a paper that was absolutely not true and was eventually debunked by the General Medical Council in Britain. And yet you bump into people on the street sometimes, and they will say, measles gives you autism, and they are absolutely convinced of that. And the more that the medical profession say that's debunked, it seems with some people, the more they double down on that. Well, in that case, it must be true. So you've got all of these things which really change the way in which we have to message. Because I suppose the question I have for you is that when we look at global pandemics and endemics in countries, and we say, what is the best way forward to contain a vaccination, if there is one, is always going to be a recommendation. And am I right about that?
Yeah, so I would say, especially when it comes to measles specifically, that is the prevention method. So, to give you statistics, one dose of the measles, mumps, and rubella vaccine will um, basically prevent 93% of infections, and a second dose increase that to 97%. Now, once again, that's not bulletproof, and as I mentioned, even if you are fully vaccinated, you can be unfortunate enough where you end up among a cluster of people that are having measles during an outbreak, and it's so contagious they can still have measles, despite that. But generally speaking, and that's hardest there are a lot of different infectious diseases, I'll put it that way. When it comes to communicable infectious diseases that have established and proven effective vaccines, that's really the best thing to do. It really is vaccinations. I mean, some diseases, there can be certain practice measures too, such as like you're talking about outbreaks of like foodborne infectious diseases, certain respiratory viruses. You can certainly have measures that are behavioral too. But I
Absolutely.
mean, generally speaking, I would say, once again, if it has an effective vaccine, it has a proven track record, both of efficacy and safety with regards to the risk benefit profile of taking a vaccine, then I think that really is, as a generality, I think it's correct in saying that it is our most effective prevention method.
Yeah. We're running out of time, Dr. Q, and I really appreciate you pitching in. But I was struck by a thought the other day that these folks who are questioning medical research and things, maybe they're a car mechanic, and maybe somebody comes to them and says, "What's wrong with my car?" And they say, "Well, you need a new carburetor." And then somebody says to them, "No, no, I don't. I absolutely don't. I know I don't. And it's just my opinion, but I don't." It's the same thing, right? I mean, it's even more because the medical profession has sort of, gone to school for many years, and it really is about how do we make sure that we cut through some of that sort of opinioning, if you like. I'm not saying it's wrong or it's right. It's just opinioning as opposed to being factual.
Sure, I'm gonna I think my thoughts are it's probably gonna part of it can be a certainly public health messaging. But I think the issue is that if you're talking about some percentage of people who are very much going to be opposed to hearing that messaging, that can be a difficult means of trying to reach them. I think for those people, who are at least willing to open up the conversation to consider that perhaps their opinion is not necessarily correct, or perhaps their opinion needs clarification in some respects, I think it's going to be first thought I had was approaching them like, what are your specific concerns, I suppose? Because some people, I think it really is in some ways like a person to person basis. Like I can imagine there are some folks who, when it comes to vaccines, they very much are say they come from a very, well, say like naturalistic or holistic or background, which is say like they want to try to minimize like man-made products. They don't want is et cetera, et cetera. They're very much into things that are from the earth, so to speak, or minimally processed, and that can they have concerns from those ends in regard to safety. Some other people they don't have trust in medical practice as a whole because they feel like say they are, at least in this country as an example, like a racial ethnic minority who's they have established,
Right,
unfortunately, records
right.
where their people have had
Tuskegee, yeah,
discrimination and had horrible things done to them
yeah,
through the medical practice and the medical societies. They may have hesitancy because of that. I think some people they simply, they maybe some people even have a scientific or medical background and they look at certain interventions and for one reason or another they have their own misgivings and they have their own lens, and that's another scenario altogether. I think it's almost kind of like how it is in medicine or any troubleshooting, because I'm trying to look at an approach where there are people who I'm not saying is necessarily I'll say it this way, yes, I think optimistic from a public health perspective, it is troublesome when there are certain vaccines. Let's just talk about measles, for instance, where once again, effective track record, it can there are uptick in cases of measles in this country as a general trend recently. Is that when you're trying to actually try to solve that problem, I think one of the first tried things to answer is why trying to basically diagnose it. Is there like some percent of people who have this issue, some other percentage have this other issue, what has been tried. Um, Granted, there are some people who, I'm not saying they're always going to be like this, who, when you try to approach them, are just not going to be willing to have that
right,
conversation, period.
right,
And I'm not sure to do in that case. I think, if that person's were, say, in a medical office and let's say their primary care physician is trying to get them to stop smoking, and they're saying, are you willing to talk about this? And they say no. And then you ask them, try to probe a little bit, and they still say, I just don't want to talk about it. That's kind of a very specific scenario, but there unfortunately may just be people like that too. I'm not saying that we necessarily stop engaging with them, but at the same time, it has to be reassessed because that stance can change with time, and that may not be fixed or immutable necessarily. But
yeah,
yeah, that's my first thought is that I think to try to get through this issue, the first thought is to try to really target and hone down like what exactly has eroded trust. I mean, I can probably think of some of it. Unfortunately, at least in the United States, has probably been some measure of public health messaging, especially early on in 2020.
right.
And then like perhaps some of that interaction with I mean, I hate to say it, but like I feel like a lot of public health messaging has gotten political in some way
Yeah,
or another too. So that's not helping things either.
yeah. No,
Because when it yeah.
I totally agree with you. I think, that really did have a massive effect to us on COVID. Dr. Q, yeah, we are actually out of time, but
Sure, sure.
But I would love to continue this conversation, maybe in a couple of months and see where we are with
Okay.
this, and see whether this is a bellwether for how we're going with infectious diseases in America and in fact in the world. But thank you so much. I really appreciate you helping our viewers and listeners understanding a little bit more about the world of infectious diseases. Thanks so much.
All right. Yes. And thank you for having me on. Thank you for your time. Have a good day.
Thank you so much. Goodbye, everybody.